Pinto.
Yes,
Sanjay Pinto.
Hello and welcome to the maiden episode of Healing Touch on the Sanjay Pinto Show. COVID vaccination and heart patients, do they go together? There are several questions that are on your mind, I'm sure. If you're a heart patient, or if you have a family member who's a heart patient, or a friend who's a heart patient, several of these doubts would clog your mind. And to answer all these questions, we have with us a Braveheart cardiac surgeon, Vice Chairman of the Frontier Lifeline Hospital, quite the chip of the old block, son of the legendary cardiac surgeon, Dr. K.M. Cherian. We've got Dr. Sanjay Cherian here, my good friend and schoolmate, classmate at Don Bosco, somebody who's done a Mexican dance with me when we were in kindergarten, right? And he's still got that spring in his step. Sanjay, thank you for joining us on the show. First off the block, do both the vaccines, do they pose any risk to heart patients, be it Covishield or Covaxin?
First of all, Sanjay, thank you for the invitation. Great to be here and good luck for your show. In terms of this topic regarding vaccination and heart disease, I think there's a huge question in everyone's mind today. Now, if you look at the two vaccines that we have today, both the vaccines are very, very comparable, right? You have the Covishield and the Covaxin. One which is completely made in India, brought in by Bharat Biotech, I'm talking about Covaxin. The other one, which is from the Serum Institute, which is in collaboration with the AstraZeneca group from Oxford. Now, I don't want to go into the scientific part of it too much, but then both these vaccines are very safe, right? Even though they're made on two different platforms. These do contain components of the actual virus, but they do not cause an infection per se after inoculation. So that's the first question in everyone's mind. If I do take the vaccine, am I more prone for getting the COVID? No, you do not get, you're quite safe from having the COVID infection yourself. In terms of the question regarding, is it safe for a person with heart disease to have the vaccination? Yes, it is safe, right? Now, which one do we choose? That's the big question, right?
I'll come to that a little later, Sanjay, but in terms of the risk factor that seems to be posed, and that's still an unanswered question, because if you remember very not too long ago, our own actor, Tamil actor Vivek, who was actually a brand ambassador for vaccination, and a day after he took the vaccine and gave that, that awareness message, he died, so, and again, the medical report also didn't quite clearly state the cause of death. They said it may not be due to vaccination. So the word may not be, those words were used. And so people had understandable fear post this unfortunate tragic incident. Now, there have been anecdotal reports about blood clotting, but blood clots being caused after the vaccination. Is there any truth in this, or is this just hearsay, just a coincidence?
Right. In terms specifically of actor Vivek's death, yes, it was a very unfortunate event. Personally, we had gone through many of the files and I had spoken to some of the doctors who were involved in this treatment. And the fact is that he did have a heart attack, right? Now, he did have clots in his heart, but he also did have cholesterol blocks in his main arteries. So that's probably the reason why he actually had the heart attack. The way we see it is that it may have been a coincidence. The fact that he had the vaccination just prior to the actual heart attack, it could have been a coincidence. We cannot rule it out completely, no doubt. But from what we see, he actually had cholesterol blocks in the heart, in the arteries, and that's what actually led to the actual heart attack. And now when you do have a heart attack, when the heart fails, eventually the blood starts stagnating and eventually you will tend to have clots. So it does not mean that, okay, he had a heart attack only because of the vaccination and the clots. No doubt clots were seen, but the clots could have happened because of the heart attack, and the heart attack could have been because the main arteries in his heart were blocked because of cholesterol, not because of the actual blood clots. So it could have been a coincidence. Nevertheless, there are so many theories around. We cannot rule it out completely. But in my mind, I'm quite clear that it was probably a heart attack which caused the heart failure. and the blood clotted because of stagnation of the blood. So that's not exactly the reason.
Okay,
It's
so
just a cause.
what you're saying is the vaccination is not a contraindication for heart patients, but in fact, it's an indication that those who are, who are heart patients need to actually take the vaccine. Why is that heart patients, among other, patients, are more susceptible, more vulnerable to this COVID infection?
Now, the thing is, patients who have heart disease are more prone because most of them have these risk factors. So we're talking about diabetes, blood pressure, and cholesterol, right? As a result of which, most of these cardiac patients are already susceptible. So when you have diabetes, especially, your immunity is a little on the low side. And when your immunity is low, the chance of any infection, not just COVID, any infection is much higher. So my take on this, my advice to all the heart patients around would be, if you have not been vaccinated, it's high time that you got the vaccination done. So just because you're a heart patient does not mean that you are going to have complications because you took the vaccine. You are more prone to have complications from COVID itself rather than from the vaccine.
That's well put. I think that should be reassuring to many of them. Now, what are some of the precautions that heart patients need to take before vaccination, before V Day, as it were? Uh, for instance, those who are on blood thinners, should they stop blood thinners before vaccination? When can they resume it? For how long should they stop it? And how do you actually classify blood thinners? Are they classic cholesterol medication, or what are they? What are some of the common terms? The pharmacy names the medicines of blood thinners, so people will be aware.
Sure. So, see, blood thinners are basically agents. We call them as anticoagulants or antiplatelet agents. Platelets are one of the components in blood which is responsible for clotting, right? So, when you have a small injury on your hand, blood tends to bleed out initially, and then afterwards it clots by itself, right? And that's because of the activation of platelets. So, these antiplatelet agents actually stop the functioning of platelets. So blood remains thin, blood does not clot. Now we give this in patients with heart disease to prevent clots from forming in their circulation, right? That's something which is routinely given for heart patients. Now, in terms of the precautions that you had asked for, now, strictly speaking, the American Heart Association does not give strict guidelines saying that you need to stop anticoagulants or antiplatelets or blood thinning agents prior to your vaccination. Because you need to realize that the needle which is used is very, very thin, right? And the quantity of the vaccine which is given is only 0.5 ml. So it's hardly anything at all. It's a very, very small amount which is being injected through your muscle in your arm, right? So the chance of you having a massive bleed after having your vaccination is very, very, very slim, right? And the complication rates are like almost nothing. And the complications that you will actually see is probably a little bit of bruising in the region, a little bit of swelling in that region, a little bit of pain. That's it. So what we have told is that if patients have been on anticoagulants for a very long time, what we would say is, you know what, probably if you want to be absolutely safe that you do not have
It's a matter of abundant caution.
Absolutely. Abundant caution, you would just skip it for 2 days. Stop your anticoagulant for your blood thinner for probably 2 days, take the vaccine, and the very next day after the vaccine, you can restart. But this again is not really required at all. It is not given as any guidelines. But this is, as you rightly said, if you want abundant caution, then you could probably do that. But otherwise, go ahead. It's safe.
Okay, but what about the risk of stopping? Unlike BP medication, is it okay to stop blood thinners for 2 days? Those who've been taking it for a prolonged period, or are there risks involved in stopping it?
Very unlikely that you will have a complication within 2 days of stopping this anticoagulation. Very, very unlikely. And besides, you're restarting it immediately. See, this is the same thing that we do even for patients who are going in for, say, a dental procedure. We usually tell them, you know what, just stop the medication for 2 days, go ahead with your extraction, and then restart again.
All right. So it's safe to stop. It's not essential, but it's still safe to stop as a matter of abundant precaution. Good. So that's clear. There's clarity there now. Also, there are isolated reports quoting certain research findings and surveys pointing to myocarditis. I hope I've got that right. As a fallout of COVID vaccination. So in certain countries, these reports are emerging, and we're now in an age of information overdrive, where you wake up in the morning, look at your WhatsApp messages, and begin to panic because there are prophets of doom everywhere. What about this myocarditis and other heart-related complications because of the vaccination? Can we dispel them all and say, look, completely untrue, ignore them?
See, now again, you need to realize that COVID is not affecting only the lungs, right? It's a systemic inflammatory reaction that we're seeing all over the body. So you see people who've had COVID, who probably even recovered from COVID, who end up with not just a pneumonia, they might have a heart attack. I've seen patients who are having a kidney failure after a after a COVID infection. I've seen people having a stroke. So it is an inflammatory reaction which involves many organs. It's not just one single organ, right? So the heart, yes, there is an incidence of myocarditis, which is basically an inflammation of the muscle of the heart. It has been documented, but then again, it's not very common. It's very, very rare.
Okay.
Now, the whole idea about the vaccination is to try and prevent the complications that occur to you after the COVID vaccination. Now, this is one thing which I wanted to clarify. Now, taking the COVID vaccine, both the doses of the vaccine, does not ensure that you are completely free of the disease completely, right? You can catch the COVID infection. What we're trying to do is we're trying to reduce the ill effects, the complications following the COVID. So, see, when you talk about the efficacy of the vaccine, both the vaccines, whether it's Covishield or Covaxin, they have an efficacy rate of approximately 80 to 90%, right? The trials which we have seen so far, they show that 80 to 90% of people are quite safe after taking the vaccine, and the chance of them getting an infection is quite slim. But there's still about a 10 or 20% of the patients who will end up with the COVID disease even after the vaccination. But the advantage here is that the complications that you can have after the vaccination is quite less. So the chance of death, the mortality rates after the patients who had both doses of the vaccine is actually less when compared to the people who didn't have the vaccine at all.
That's reassuring. Now, Sanjay, a lot of people who are into regular exercise, even during the lockdown, they exercise at home. They probably use a treadmill or an exercise cycle or do aerobic exercises. Should they stop exercising before or after vaccination for a couple of days? Because there are, again, reports of people suddenly dropping, fainting, losing consciousness, people dropping dead sometimes. I mean, these are alarming reports that we are seeing sporadically at least. What's your advice on exercise both prior to and post vaccination?
Yeah. Now, on one hand, yes, it's very important to stay fit, to stay active, to exercise. Just basic, simple exercises, as you said, right? A bit of walking or small jogging or cycling, whatever it may be. Stay fit, but do not go overboard with it, right? And I would say I have read these reports as well about people having complications post vaccination. So what I would suggest is post vaccination, take it easy for a couple of days. Okay? Don't push yourself too much. Take it easy, because even after I got both my doses of the vaccine.
That's why, in fact, you're somebody who suffered COVID yourself and very tragically lost your beloved mother also to COVID. So you're somebody who understands, not just a doctor sitting in his hospital, but somebody who has lived, defeated COVID, who's had a setback because of COVID. So what you say, in fact, carries a lot of credibility and, been there, done that.
Exactly. So I know I walk the line, so I know how it feels. So when I see COVID patients, I know exactly what they're going through. You feel very tired, you feel very weak, you do have a little bit of pain, fever. So what I would suggest is if you've taken your vaccine or if you've just recovered from COVID itself, take it easy for at least a couple of days. Okay? Make sure that you're like completely back on track, your fever has fully settled, your saturations are normal, your breathing is normal, your blood pressure is normal. When you get there and you feel comfortable, completely normal, then restart your schedule, whether it's your work or whether it's your exercise. Start it slowly. Don't try to jump back and don't try to dive back into your exercise routine immediately, right?
So can we say that for 2 days, whether it's blood thinners or exercise, 2 days after your vaccination, take it easy and then resume in a phased manner, in a calibrated fashion, your regular exercise?
Absolutely. That's what I did as well. Yeah.
Okay. Also, another question that's been doing the rounds, especially on WhatsApp and many in our alumni group as well. You've been bombarded with these questions. No non-veg after COVID for a week. No drinking, of course, it doesn't matter to me because I'm a teetotaler. I think you're also one. No booze, no non-veg after vaccination. Any scientific basis?
Not really, especially in terms of non-veg now. You can get back to eating normal food. Even when I had COVID, I was having a lot of chicken soups and stuff. I needed protein. I kept eating eggs to get the protein back into the system because I felt very tired. So I don't think there's any reasoning regarding the non-veg part of it. I don't think it really makes a difference. In terms of the booze, which is the very important question that everyone's asking these days, it's always better to try and abstain from alcohol for at least a couple of days, at least 4 or 5 days if you can. If you've recovered from COVID or again after the vaccination, try and stay away. The reason behind this is because no matter what you take, right, if it's any form of alcohol, it's broken down by the liver, right? The liver is responsible for synthesizing and breaking down your alcohol, right? And at the same time, there are a lot of proteins, a lot of immune complexes which are in the blood, which are again processed and synthesized by the liver. So what we're trying to do is we're trying to keep the workload of the liver as low as possible. So we're trying to give the liver some rest to do one thing at a time. So we don't want to bombard it with too much of immune responses and all these filtration things that it has to do, and also work with breaking down the alcohol. So we're trying to give the liver some break. So if you can abstain from alcohol, it definitely would help. Although it's not compulsory and there's no specific guidelines written, better to be safe. Why don't we just give our body a little bit of a break, stay away from alcohol for a couple of days, and then get back into it. Celebrate the recovery from COVID or the recovery from your vaccination after a couple of days, not immediately.
Absolutely, good advice there. Coming back, I want to put you on the spot here, and I know you've been asked this question as well in the past. If you had a choice, in now the case of vaccine hesitancy and now vaccine scarcity, so if one had a choice between Covishield and Covaxin, and if one is a heart patient, would you say one is better than the other, safer than the other?
Yeah, many people have asked me the same question. To be honest, it really doesn't make a difference. There have been reports saying that people with Covishield get a higher incidence of clots, or immediately the media says that no, Covaxin has a bigger problem. So personally, I don't think there really is much of a difference between the two vaccines. The way I would see it is that if you do have a vaccine in hand, now if you're going to a vaccination camp and they say that you have only Covishield or you have only Covaxin, please take it. It doesn't make a difference which one you take, please take it. So irrespective of whether you have heart disease or don't have heart disease, whether you have other risk factors or not, please take it. Both the vaccines are safe, both are equally effective. So please take it. It's better to take one rather than take none.
What about women who are having their periods, menstruating women who are lactating mothers? What about them? Should they wait for a period of time for taking the
We
vaccine?
had gone, we had gone back to look at that as well because we were really concerned about both mothers who were pregnant, people who were lactating, okay, during cycles. None of these are contraindications for the vaccine. So all of them are safe. And they have seen that even people who are lactating, who are breastfeeding, they don't have an issue with passing on the antibodies to the child. So that's not a problem at all. It's not a contraindication of pregnancy, lactation, or periods. It is not a contraindication. You can safely go ahead with the vaccination.
One final question, Sanjay. For the patients you've seen, how many of them have taken the vaccination and have had absolutely no side effects and are absolutely fine? So that would probably give a lot of confidence to those who are watching this program.
Yeah. In terms of the complications or the issues that they faced after the vaccination, including me, is that we had very mild pain, very mild fever, or feeling slightly tired on the first day or second day. But that's something which is very limited. It happens only for
No,
maybe
no,
a
no
day.
cardiac-related complications. That's what I'm asking you. Any cardiac-related complications among your patients? None at
Not,
all.
not that I, None at all, not at all. And what we again saw was that, as we all know, the second wave of the coronavirus was worse than the first, right?
Yes.
And we had a lot more deaths in the second wave than the first wave. And what we did see is that the patients who actually died this time were primarily patients who were not vaccinated. So people who were vaccinated somehow made it through. Even if they were sick, they somehow made it through. very few people who had both doses of the vaccine actually died. So again, bring the same point forward again would be, if you have not been vaccinated, please go and take the vaccine immediately.
I've been suggesting, in fact, I even tweeted to the corporation and health department that, when not long ago, when we used to have these fatal road accidents, uh, the media used to report so and so was not wearing a helmet or was wearing a helmet. Similarly, I think with the death toll, they should also give us a breakup of those who've been vaccinated and who've died, which probably would be negligible, and those who've not been vaccinated and who've died in that death toll, those death toll figures, so people will be motivated and will feel safe to come out and get that vaccination as and when it's available. Sanjay, do you think this is a good idea?
Absolutely, I completely agree. True.
Thank you very much, Sanjay, for sparing your precious time. We'll let you go back to your patients now because we know you're a doctor who rescues patients from the jaws of death. We've seen that with our own classmate Don Fernandez, whose life you miraculously saved and turned around. God bless you, and may you continue to do the great work that you're doing. And we'll keep coming back to you for all our queries, and we'll bounce them back to our viewers and get feedback from them as well. Thank you so much. I'll give you a fist bump because I think that's the way to be now in during COVID times. Thank you very much, Sanjay.
Thank
Thank
you
you.
so much, sir. Thank you so
Thank
much.
you.
Really appreciate
Thank you.
it.
Thank you.